if a patient stops LDN, so let's say they're on 3.5 milligrams for more than 7 to 10 days, do they have to re-titrate? In my training, initial start of 1 milligram for 2 weeks, 2 milligrams, then ending between 3 and 4.5. People have a negative health reaction of stopping dose for an extended period of time and then restarting back at 3.5 or at higher doses. Your dosing protocol is similar to to a lot of clinicians. A lot of clinicians start either 0.5 or 1.5. I tend to do both depending on the situation, one or the other depending on the situation. I think a lot of clinicians do as well. But in terms of stopping LDN, I have patients who stop LDN all the time for a variety of different reasons. They traveled and they forgot to take their medication. They're just too lazy, for lack of a better term, to get a refill and they run out. Or I have patients, sometimes LDN is quite subtle. So I have patients, they're not quite sure the benefit until they stop it. And then they realize, oh, I was benefiting from it. So they stop it for, a couple months and they say, oh yeah, I felt better on the LDN. Let me get back on it. The decision to start somebody back up and where to start that back up, honestly, all depends on how they reacted to it the first time. If somebody had no problem titrating up on LDN to begin with, I'm 100% comfortable just having them start up where they left off. However, if you get that patient who really struggled to titrate up on the LDN, that's where I would pause and say, okay, well, any pause more than, let's say, 3 or 4 weeks, then I would probably at least back down on the dose. Maybe not start all over again, but back down on the dose and work up. Of course, if the gap is more than a year or two, and again, somebody struggled to begin with, I would retitrate them. If somebody didn't have any struggles at all and was able to titrate up and had no side effects, it doesn't matter how big the gap is, year, 2 years, 10 years, again, it's usually little problem in starting them back up where they left off. Again, it all depends on the person.